Welcome to Restoration Beyond the Couch. I'm Dr. Lee Long, and in this episode, I'm joined by Dr. Casey Ratliff, a physical therapist with a deep understanding of how our bodies and minds are connected. Together, we're exploring the physical connection to mental health, how things like posture and breath, movement, and physical tension can reveal what's happening emotionally and how mental healing is connected with our physical bodies. Whether you're dealing with stress, anxiety, or just trying to feel more aligned, this conversation offers a grounded, practical look at the mind-body connection. Your path to mental wellness starts here. Welcome, Casey.
Yeah, thank you.
Dr. Casey Ratliff to Restoration Beyond the Couch, and I'm so glad you're here. I know you and I've had, countless conversations about how physical therapy impacts, or how physical wellness impacts emotional wellness. And we've had a lot of fun discussing that. And I know you've had a tremendous background in the physical world. Would you give our listeners just a little bit of background on you and kind of maybe how you made your way to physical therapy and like just that whole,
Sure.
your whole background there.
So, longtime athlete. So I always loved the movement of the body, competition. So I thought, physical therapy, that'd be cool. And I don't know if you knew this, but I wanted to be a counselor before.
I did not know that.
Yeah. I had a psychology degree. I was going to do psychology at Texas Tech. And
that makes so much sense now.
Isn't that funny?
Yes.
And my dad said, "Why do you want to sit and listen to someone's problems all day?" Joke's on me because I still do that, right?
Right.
But now
except you don't sit.
Yeah, exactly. Yeah. And so the funny part of that is that we're still psychologists every single day, psychologists in quotes, right? Working with people. You're working with humans.
Right.
So they walk in there, but they didn't leave their brain at home.
No.
Right. And so that's really where I got interested. I was always fascinated with the brain, the mind. But then on top of that, I had this whole movement fascination that I love. So I feel like that's why I went into physical therapy.
That's really cool, Casey, because I didn't realize that.
Yeah.
But I don't think I've ever told you this, but I originally thought I was going to be a physical therapist. And the reason why I didn't do that is because the feedback I got was, why would you want to go into physical therapy? The burnout rate is so high. So I chose mental health therapy where the burnout rate is equally as high.
Right.
Yeah.
So it's like, how can you get the best of both worlds, right? In that. And why I isolate them, right? Mm-hmm. So I graduated with my master's and doctorate and then kind of started the real world. Yeah. And I experienced that burnout. I was in a high volume clinic and you're just pumping them out. And if you really think about when you think about therapy or seeing a therapist, physical therapy is one of the only therapy that you have to see multiple people at one time in the normal general setting.
Interesting.
Yeah, because you're seeing 2 or 3 patients. And what I found when I was doing that at a high volume clinic, I moved to Austin, that was my first job, is I wasn't able to really get to know my people because I wasn't undivided attention with them, right? And so then I stumbled in, I did a lot of continuing ed right out of school, a lot of heavy manual. And so for people that understand what that means, like adjustments of the spine and soft tissue, and that was really where I was headed. And
the interesting thing about the whole manual place is that someone shows up to you and you're the one doing something to them. In other words, there's a lot of reliance on you. So you make me better.
Right.
Got it.
Yeah, okay. Exactly. And so that, exactly what you just said, with those heavy, you kind of create this return value, right? Mm-hmm. I need to go back in because Casey did that thing on my back and oh man, it made me feel better.
Right.
And I love manual. I think touching people, having your hands on people is really important, right?
Sure.
So that's kind of where my right out of school, where you literally know nothing. I knew how to swing a goniometer and measure a range of motion, right? But you know nothing.
Goniometer. That's right.
That's
all
right.
That education for that.
That's it. I know. And so then about 2 years out, when I moved to Austin, I'd done these spinal mentorships, soft tissue mentorships. I found what I study now and practice. It's called PRI. So it's called Postural Restoration Institute. And, I saw it being practiced in this clinic and I'm like, what the heck are they doing? Because really I wasn't fascinated with neuro. And I was an athlete. I wanted to do orthopedics and get people stronger, right? Yeah. And the funny part, the joke's on me in the end. I wish I would have paid more attention to neuro in school, because that's all physical therapy really is. It's neurological. Muscles are connected to the brain. How are we going to get them stronger? How are we going to, but if the brain doesn't sense it, doesn't understand it, it doesn't really matter, right? And so I started studying physical therapy or postural restoration pretty slowly. It's a lot of science. So we're out of Lincoln, Nebraska. Ron Hureska, you've had the pleasure of meeting.
Oh my gosh, have I had the pleasure of meeting him?
Yeah, he's amazing.
Truly amazing.
There will never be another human being like him. He just celebrated his 70th birthday. Wow. And he created this science based on many different things, but to kind of, for people at home to understand, posture is not standing up straight, get your plumb line out, do your ears line up with your shoulders and your hips. And that's not what we're looking at. So when we look at posture, we're looking at a reflection of all the systems internally. So you got to think about the musculoskeletal system, the respiratory system, the osteosystem, the digestive system, the nervous system. I mean, we're compromised of multiple.
Oh, yeah.
And so how all those interplay is kind of posturing. How do we posture ourselves? How are all those playing together inside?
I feel like for PRI, the term posture really is similar. The way that you all have expanded that, well, taken it to mean all of the things it means, in the same way that CBASP for me in my adventure of being a therapist and growing and learning all the different themes uses perceptual understanding. It goes beyond just what you're perceiving. It goes beyond just the structure, meaning posture goes beyond just the structure of something. It's what it all, it's everything that's comprised in it.
Exactly.
Yeah.
Yeah.
It's so interesting. When I met Ron, we had the great pleasure of having dinner with him and you, and talking with him. Like, I've always seen the world that the physical is an analogy for the metaphysical. Like, the physical helps me understand the metaphysical. And hearing him speak and showing like all the ways that our worlds are woven together was so exciting.
Yeah. And powerful, right?
Yeah.
Because when you really can tap into that, that's when I feel like, as a physical therapist, I started making a really big difference in people's lives.
Right.
Not that their hips started getting better. Sure, that's great. But other things started improving in their life. And so when we look, when I assess someone from postural restoration, for people that have no idea what it is, like the quick elevator speech,
right?
Yeah,
what's the background of this?
Yeah. So kind of a few foundations. And the biggest foundation that we look at is our bodies are asymmetrical. And so that's fact. I mean, you can go look inside cadavers and see this, but our right diaphragm, we have a diaphragm muscle we breathe with. We have a lot of diaphragms in our body, but our right diaphragm, the hemidiaphragm, is significantly larger than our left. It attaches lower on your lumbar spine than it does on the left side. This is a muscle you use 20,000 times a day, and it's bigger on the right. And so there's I don't understand why it's not more emphasized in like the professional schooling. Right. Because I did 2 years of cadaver lab and PT school. I even assisted the next year. And, it was just never really kind of
talked about.
Yeah, brought about. And then you can look at your organs, right? You got a liver that sits on your right. You have 3 lobes of lung on your right because you have your heart on your left. And so this big diaphragm pumps us full of air, but it's going to be different about how that air expands within us.
It absolutely does. And the one thing, though, before we move to the air piece of it, is did you know that our right hemisphere of our brain is larger than our left hemisphere, which is just so interesting because it does something so different, right? It's the lobe that generalizes or synthesizes information, right? The left side, yes, it grabs things. Yes, there's that, but it's so interesting that this is mimicked in most places. this right-sidedness.
Yes. Yes. And then you look at, and it's not a handedness conversation, but
Right.
90% of the population is right-handed.
Right.
And most ambidextrous, left-handed people are ambidextrous. So you have the center of mass of your body, and you already mentioned it, the brain. Our right brain and our left brain are different. Our right brain controls our left half of our body, and our left brain controls our right side. Right. And our left brain's our language and our logic. And like you just said, we rely on both of them for different things. But our left brain, we have more neuromotor points on our right side of our body. And so these are all just factual neuroanatomy things. And we're trying to live in this world of where people think your right leg and your left leg are the same. And the way you sense your right hand and your left hand are the same. So let's treat you as if you're a bilateral human being when your brain and your body positioning really only understand one half of that body. And so
how does that, could you give me an example of that? Like, how does that play out?
Yeah. So I think, well, let's just let's kind of take it into a movement perspective,
Sure.
right? Let's just look at a generalized workout. So I've spent a lot of time working with professional athletes, right? So I was like kind of always our joke.
Yeah.
I worked with the NFL Combine for 5 or 6 years. Just the
Yes,
prep.
and I'm still waiting for my agent to call. But yes, thank you for keeping me ready for that.
Yeah, you got to get that bench press up, right?
That's right.
225 burnout is one of their measurements. Anyway, so that's a great one to use, right? Is that really an expression of strength? Is a bilateral bench press at 225 and you knock them out? You know, we had guys tear pecs. And it's like, these are amazing athletes. Is that really what we're trying to do here, is just heavy push through bilateral loading of a body and system that doesn't understand both sides of the floor or both arms? So I guess what I'm trying to tie in with that is when we think about a workout or a load and we're overloading these bodies on on both sides, your brain doesn't perceive both sides that way. So I think, shifting how we program, and I like this because I love the strength and conditioning world, into more of that asymmetrical mindsets, right? Or alternating activity. Our brains love alternating. They want us to reciprocate. One arm goes forward, our other arm should go back, which is a chest wall, rib cage. One goes forward, one goes back. Pelvis, leg. When people look at gait, they just look at the legs. It's like, well, what about up the chain, right? What are the legs doing? But what are those arms doing? And
so as opposed to sitting to laying back and doing, burnout of 225 on the bench press, would your suggestion be like a piston type pump?
Absolutely.
Where you're lifting one arm and lowering the other, or raising one arm and lowering the other and then raising. So it's like it's operating as a piston.
Yes.
So
alternating.
Do you believe that our body sort of pendulates? Like things operate on like a pendulum, where it varies from one side to the next.
Absolutely. It's called oscillation, right? And if you don't oscillate, your nervous system is going to go up. You've got to oscillate. You got to turn on, turn off, turn on, turn off. The term we use a lot. And I would say that so I teach for the Institute as well. I'm training right now to teach our cervical course, but I teach our hip course. And
cervical being low back or back?
Cervical spine's the neck.
Right.
Yeah. And it's okay. It's not your field.
Lumbar.
Okay. Yeah. And so is the term, and this is what's so hard in the world we live in now, but the term that I use and we teach on, and this is what PRI is literally foundation, is called inhibition. And it's the neurological, you never turn anything off completely. It's the dialing down of overworking. I mean, look at what we're doing as a society.
Right.
When do we ever shut down? Right. And so when people come see me, it's not like, let's do a lot more. It's like, no, let's see what we can turn off. So we can keep this really simple, layman terms. You walk in with quads that are popping out of your pants, right? That means somewhere in the chain, aka hamstrings, are not working. So we got to balance that off. So let's figure out, how can we get that person to use less quad, more hamstring? That's a really easy layman's terms, but that's what we're looking for, is inhibition. How can we get people, how can we meet their needs, but then be able to bring them back?
Sure.
Right?
Sure.
Does that make sense?
Makes perfect sense.
Yeah.
And I think about, trauma in trauma in our world of trauma. There's a lot of that, right? We try to help people slow down that hypervigilance, right? It's like knowing that I'm safe in this moment. And I think that there's so much, like you said, the pendulation. I think about like ART, the accelerated resolution therapy that I love.
Mm-hmm.
And it does, I also have used and used from time to time EMDR, the eye movement, reprocessing, eye movement, reprocessing and desensitization. I always have to think through that one. But the EMDR, where it involves the movement of your eyes, right? And it's the bilateral stimulation, just like what you're talking about of like bench press. It's better if it's bilateral, where the body actually, what I'm hearing you saying, is working together.
Yeah. Alternating.
Right.
That's the word I always come back to was one side's working, the other side should be going back, and vice versa. That's gait. That's moving forward in life. Most people are moving forward on both sides of their body at the same time.
Yeah.
We got to go.
Yeah.
We don't have time to pause, stop, get back on one side. And we find this asymmetry with PRI testing. So we have a whole slew of objective testing from the eyeballs to the toes, where we're seeing when people come in, what position are they living in, right? And so that's kind of my job, is how do we inhibit and kind of get them back a little bit? Because then once you inhibit and get them, we'll call it feeling better, whatever that means, but on my terms, through testing, then you've got to hurry up, not really hurry, but repattern. So when I teach, it's reposition the body first, then you got to repattern it, because now it's got this new thing and it doesn't know what to do with it.
Yes.
Then get back to reciprocating, how to use both sides, which is alternating. So
yeah. So when you walk through this with people, like you said, you get elbow deep, pun intended, in their life.
Yes.
Right. I mean, I know you're not doing a ton of manual work, but you're in there with them.
Yeah.
At what point did you begin to see, like you said, we're all psychologists, like at what point did you begin to see the mind body connection in your work?
Yeah, that's a great question. And I'm trying to think if there was like a few moments. I feel like it's just developed over time, maturity on my end as a therapist too, just really stopping and pausing. If I really had to pick though, I think it's when I went out on my own, I started seeing clients. And when I say out on my own, I mean away from the clinic. I started my own practice.
Right.
I started seeing patients one-on-one. And that time, I've always had a deep interest in people. I've always just loved and fascinated by what makes you, you, right? And that's what I love. PRI ties into that.
Yeah.
And so that's where I started to see when I was more one-on-one, and my intake, my patients are like, whoa, you were asking me like all the way back to when my first tooth came out almost. And I'm like, yeah, because it matters. Yeah. Because you developed your little nervous system way, way back then. And so how you are intertwining, maybe that's not the right word, interacting with the environment around you and within yourself came from a really young age.
Right.
And so if we don't go back and see kind of how you were developing, and this is, pretty extreme too, but I want to know if patients had braces on their teeth. I want to know like were your neurological systems messed with at a younger age or even at an older age. And all those do. And as you know, I work with an optometrist and a dentist on my team. So I have a pretty integrated team because we're just trying to figure out how we can help these neurosensory processing systems that you own, that you may not even know there's anything else out there.
Right.
Right. And I was trying to think what you asked me that got us here.
When did you notice that the two go together?
Yeah.
But I love what you're bringing out is like when you started meeting with people and you took them for where they are.
Yeah.
And I'm thinking about, I was listening to something where Mark Hyman was talking about how he became a functional medicine doctor. And he said that it was really through his own lack of health, through a series of things that developed in his own body. And he was like, nobody could answer this, and nor could I. So he said, I became a really good investigator. Yeah. And I was like, wait, that's kind of how I feel is when somebody comes in, it's not to be cold and removed, but I am investigating with them. Hey, what happened? When was that point you noticed? And they bring in a set of symptoms, and then we work to find what's at the core of that. Right. And it sounds like you're saying when you were working one-on-one with people, all of a sudden you had the space to take the symptoms, that set of symptoms. Somebody comes in with knee pain, and what you realize is it may be the positioning of their neck, and maybe how they're breathing. And it may be, and this is where I'm curious where you're going to go with this, but it may be how they're breathing.
Right.
And
Yeah, did you take a PRI course?
I feel like I have.
I mean, look at you. That's amazing.
Yeah.
But yeah, so I always start with breathing, foundational, right? I mean, that's something really easy you can do just sitting in your chair. And so one thing I'll really work with people on is breathing step one, like day one, because that's something they take away.
Mhm.
And so anybody at home right now can even assess this, but our right nostril, when we process air into our right nostril, and this is research based, you can look it up, but that's more our sympathetics. Our left nostril is more our parasympathetics.
So sympathetic is movement forward. It's the excitement.
It's fight or flight,
Right.
more so. It's not a bad thing. You just
Right.
don't want to live in it
Right.
when you're trying to go to bed at night.
Right.
Yep.
Parasympathetic is the rest and digest. So
Right.
it's the smoother.
And you would love a cycle of that.
Right.
You want the brain to feel that cycle. That's called your central nervous system. And then underneath that, you have an autonomic nervous system. And I see a lot of people that have dysregulation of the autonomics, right? And so we've got to somehow get this brain and this body to cycle again. So
And the autonomic, sorry to interrupt,
Yeah.
but the autonomic is that which is functioning in the background, our
Yes.
heartbeat,
Yep.
our ability to breathe, those
Yep.
types of things.
yes.
Am I missing anything there?
No, that's a great easy term, right?
Okay.
For that, I think. And so something I'll have my patients do that I feel like, man, I don't know if you're going to get to a place to relearn and repattern until we can get you uninhibited a little. We just need to get you where you're in a place to learn something new. Does that
Mhm.
make sense?
Yeah.
Because the brain loves novelty.
Right.
But if you're not in a place to accept it because you can't shut down ever, you're not going to be able to relearn anything.
Right.
And so a lot of times I'll do alternate nasal breathing with patients. So that's literally putting their hand up and putting 2 fingers on their left, thumb on their right, and they'll close one, do a nice slow cycle in, pause, unplug, let the air out the other nostril. And so we will work on alternate nasal breathing. I'll have them work on that throughout the day just to kind of get that calmness, right? And that's not for everybody. It just
Mhm.
depends on, who's coming in. But that's a great trick for people that, well, it's not really a trick, treatment for people that may have issues going to sleep. Like I can't shut down at night. My brain's racing. So that alternation kind of can cause that.
Right.
Help
That undulation,
cycle.
that
Yeah.
pendulating, that
Yeah.
oscillating
Yes.
back through.
Yeah.
It's interesting because one of the things that I see when somebody's in my office, when somebody's talking about something very painful, very often the terms that will come out of my mouth are, please take a breath.
Hmm.
Please breathe while you're talking about this, because there's that, it's so painful that the body is bracing for that impact, right? And you think about the things that, like, you think about how the psychological aspect of things impacts the physiological aspect of things. We're not just talking about heart rate. We know if you're scared or anxious, your heart rate goes up. Like,
Right.
That's pretty factual.
Yeah.
But it also releases more cortisol when you're afraid, which releases more insulin, which is why people who have experienced childhood trauma or have adverse childhood experiences, the ACEs, when people have experienced those over time and have that childhood trauma in their background, they're more likely to have diabetes. Right. And so there's that weaving together of how our body and our brain work in tandem. And when you teach somebody that bilateral nasal breathing, I'm curious if in their background, oftentimes there has been a history of anxiety or some type of trauma.
Right. Yeah. And I feel like probably most of the patients I see, I would say more have some sort of, and I'm going to call it trauma lightly, right? I mean, it could be, what I mean by that is it could be a car wreck. That's trauma
It is
to the
trauma,
body,
right,
right?
right.
And so, or it could be emotional trauma. They were raised with parents that yelled all day.
Right.
And so how that ties into the breathing is, what are you using to get your air in and what are you using to get your air out?
Mm-hmm.
And that's really what we want to look at first, because that diaphragm, if you opened up a chest cavity, or, it's pretty low all the way down where it attaches on the lumbar spine, it intertwines with your hip flexor called your psoas muscle. You cannot separate them if you wanted to. So there's a chain of muscles, and that's what PRI, from the tip of your head to the toe, and we've identified them, named them, but those chains of muscles become more dominant on one side of the body. Thank you, right diaphragm, and less on the other. And they're different. And that's what we test for, right? But so these patients that you may see that are tensing and holding, I mean, what are they using all day long to do that?
Right.
And to pull air in, because their diaphragm's not able to work if they're constantly overusing their neck to pull that air in, if that makes sense.
Sure.
And so, that's kind of what we start to try to break down and look into, like, what's their strategy here?
Yeah.
And I would tell you the biggest thing that if I were to take 80% of my caseload, is most people are more in a state of inhalation, kind of stuck. So you see the ribs are up in the front. And so even like for listeners at home, even like kind of putting your hands on your lower ribs and then just taking a breath in. But then as you exhale out your mouth, try to make your exhale twice as long as your inhale, and see if you can sense those ribs move down. And that's called exhalation, which to the brain is like, oh, thank you. It's a neuropause. Now I can reset. And then from that fully exhaled state, let's inhale and let's fill it all up, versus, well, my ribs kind of been up for 45 years or whatever. I'm kind of kidding, but you see the implications about a rib cage that doesn't move. Look at all the muscles that are attached to that, and the spine and the back, and all those muscles that are keeping you in that posture to keep you alive, to keep air in.
Which sends what to your brain?
Right.
You know what I mean? It's the whole sympathetic nervous system. It's either fight or flight. Mm-hmm. And then you think about the psychological implications of that.
Yes.
And all the things the ways that you ingest or interpret information. If you're up and out and your brain believes that there's danger everywhere,
right?
What does that do? Right. And I think about the wear and tear on us physically when we have an emotional space that's really a struggle.
Right.
Or when I think about when we have a physical place I think about athletes that get injured. Right. And you have to put them in neutral, so to speak, physically. Mm-hmm. And what type of absolute, I don't know a better way to say this, but damage it does to their psychological health.
Right.
And then vice versa.
Yeah.
Right. When our bodies are in neutral, what it does to people who don't move through life. What are some examples, or do you have some examples that where you've seen our worlds collide?
All the time, every day of my life.
Yeah.
Actually, this morning. But yeah, yesterday. So I work with a professional women's basketball team here in town, and I was seeing. So I just kind of consult with the athletic trainer. She loves PRI. And so I come in every few weeks and get to see the players, and I absolutely love it because, man, basketball players, they are just beautiful movers and they get it, right?
Oh, because everything is really bilateral there.
They're so fluid.
I never would have thought of that.
You keep saying bilateral, but I think you mean alternating, like one's going forward, right? Yeah, they're able to get their bodies to move and shift.
Yeah.
I mean, I can do bare minimum with them and they're like just drastic changes, right? Mm-hmm. And I was seeing one of the newer people on the team, and there's this history, right, of a left knee surgery, a left ankle sprain, a right ankle. But anyway, whatever it was. But I go back into that because I want to know, like, when did your brain stop trusting the floor underneath your foot? Mm. And it's the minute you have a sprain or something happen, right, or surgery, all of a sudden that's not yours anymore. Your brain, someone went in there physiologically, it's changed. That's what your brain knows, right? But it's threat to your brain. Mm. And so then your brain is going, well, I'm going to still walk. I'm still going to run. I'm still going to do all these things. So you immediately do something called accommodate, and you start accommodating for that. But what does that accommodation look like over time? And that book could be long.
Right.
That's where I'm here to, when I look at people, it's like, man, how have you been accommodating around that left knee, and you're playing a high level professional sports?
Right.
What have you done to get around that? Right. So that's one. And then one specifically, because I think, and you know this, because I'll shoot you a text. I'm like, who should be seen for a 30-year-old guy, like, who's your best, for this problem that I think is going on. So, and what I mean by that is my clients will be working together. And one specifically I can think about without giving too much away, we went through the process. And I don't want to overwhelm because it's a lot to talk about integration, but sometimes we'll use dental sensory appliances in the mouth to help the position of the neck and the cranium. That's the best way. That's easy to kind of put it. And she was being seen for a lot of different things, and we resolved everything pretty much, except for her right neck would still bother her. And she had a history that she didn't really resolve. She was in her later years of life. So, already raised a kid and is off to college, and that she had unresolved with her parents. Parents are both deceased. And that every time her mom came up on a radar conversation, her neck would tighten again. And that's patterning, right? She would
absolutely.
She loved to center her mass over her right side. And when you do that, you got to turn your head slightly to the left. Otherwise, you're going to fall over. Well, you know who does that? Your right SCM muscle right here. And so anytime her mom, and we kind of came to it together. I mean, and so she started doing all the work at this practice, actually, I believe. But, and it's a lot because then you have to unpack all that. But in order to really repattern herself, she really needed to, and she knows it, and she'll probably come on the podcast and tell you. But so it was interesting that physically I could get her where she wanted to be, but I didn't have the tools to work through that with her, nor the license, nor the, you know what I mean?
Right.
So that was one specifically that I thought was really interesting. One more that I could think of that I saw her about 6 weeks ago, and man, we were killing it. Everything was moving well. And she did see an optometrist in between, and they tweaked the prescription a little bit, but lowered the power, which is usually what I'll see. When I say that, what I mean by that is you have a prescription you get from your optometrist, and the more minus that's in it, that helps you see further distance.
Right.
So we took some power out. We didn't. He did.
Right.
And so I'm like, well, things should be a little bit better when she came to see me, but it's not. And I said, are you sure there's nothing going on? She's like, oh, yeah, I'm working through a lot right now. I encouraged her to see a counselor last year. And she's like, I'm working on forgiving people in my life right now. And so she's going through this work with her counselor.
Yeah.
And I said, well, is it more? She goes, oh, it's heavy right now. It's heavy the past 4 weeks.
Oh, wow.
And so I'm seeing it show up in her body by she's trying to kind of go back to her old patterning because she's trying to stay safe in her body. And I'm trying to no, let's turn it off. Let's give you this newness. But her brain's still relying on that patterning. Does that make sense?
Makes perfect sense.
So that is, if I wasn't tuned into that, I'd kind of be like, well, you're not doing your exercise I gave you.
Let's talk about that. Because if you go down that road, well, you're not. How does, think about what that would put upon somebody who's already doing so much heavy lifting.
Yeah.
My mentor and I were talking about this concept just yesterday about how there's these people that are treatment. This is the title we're giving them in our field, treatment resistant depression, because the theories that are widely known aren't working for them, and medication is not working for them. And it's like, okay, so that's something's wrong with them. It's like, well, wait a minute. Why can't we evaluate what's being done and not say something's wrong with anything, but something's not matching up?
Right. Instead of the blame game.
Right. Exactly. Yeah. I say so often in my office, blame and fault are the B word and the F word. And we don't speak like that here.
Yeah.
Because that's such a freeing place for you to be moving with the people that you're treating.
Right. Yeah.
I love that.
And that's why I feel like I went out on my own. So I have the control. I don't have somebody telling me that. I don't have insurance dictating, the range of motion didn't get better. You need to, we're cutting you off.
Right.
But I mean, I only see my clients once every 2 weeks or so, and so it's not like you need to come in 3 times a week, because then I try to empower them to have these 2 things to do. It's never more than 2 or 3 things. But if you think about old habits die hard, that's really true. So maybe it's like, hey, for people sitting at home right now, and maybe you're sitting, literally sitting, where do you feel more of your pressure? Do you feel it in your right butt bone? Do you feel it in your left butt bone? Right? Do you feel that your head maybe is tilted? Is a shoulder lower? And those are the kind of things where if we can just put a little impact, 30 seconds when you're brushing your teeth, can you stand more over on your left leg? I mean, this is just a random example, right? But those things are really pack a punch. Like they're a lot more effective than my 3 sets. And I'm not trying to hate on traditional physical therapy. I'm not, because I think it serves its purpose for many reasons, right? I just think that we are not taught to treat the human as holistic and looking at the neurological implications about what we're really dealing with. Yeah. And so, go ahead.
I love that, because that's my framework in the psychological realm, in that more metaphysical realm, is let's be more aware of you. What thoughts come into your mind? I had somebody ask me just this week, like, okay, so is really being aware of how horrible I talk to myself, of my internal monologue, that's going to really help me? I'm like, yeah, far more than you realize.
Yeah. This was a quote from Ron, and it's like, what you've been taught isn't wrong. It's just incomplete.
That so sounds like Ron.
Right.
And I love that, because it is incomplete.
Yeah.
And there's no blame and fault here.
No.
But there is let's take it to a different space.
Yeah.
Because when we do recognize those little corrections, and what I was saying to this individual is, yes, little corrections help over time. Mm-hmm. Because and I gave him the example of like a fad diet. If you just drop weight like that, mm-hmm. But it's really restrictive and really, difficult to stay on it. The minute you get off, what tends to happen? You go back and seek homeostasis, or seek that balance that you just left. So what if we just change the way that we balance, figuratively speaking? For you, it's literally speaking.
Right.
But what if we just slowly change the way we balance, so that balance becomes something that is normal to us? It becomes our balance, our homeostasis.
Yeah. No,
I love that.
Yeah. Small movements, micro. And here's the problem. We live in a world where it's instant gratification, and we want to be better yesterday. You didn't get me better. And so that quite often I will know immediately whether I'm going to be able to help someone. Mm-hmm. And most of the time I feel like I can, right? And PRI has gotten really popular because we end up seeing a lot of people that have been struggling and have seen multiple providers. So I always joke, I'm like, I don't get the easy cases anymore. It's these complex scenarios. And I say complex, they're really not. They're just looked at incompletely prior in the world. It's like, I've been to 4 physical therapists, 6 chiropractors, and my whatever still hurts, and it's like,
sure. But I think what you're pointing out here is that PRI is very aware of all the different input systems, which our psychological input system is a big one.
Right.
It's a huge piece that like you're talking about this person who's walking through forgiveness and their neck is acting up again. It's like, because the way that you coped with that may have created a physical pattern for you that you may not be aware of.
Right.
And it may be a very insightful place for us to look and say, wait, what's psychologically going on here as well?
Right.
Because what we both know is that there's a very thin veil between the psychological and the physiological. And
you can't separate them. And, I mean, you just kind of can start to think about when you're having a bad day, you can, if you just think of your worst day, or even maybe you had let's just talk about grief, right? How did your body feel versus the day that you graduated, or you had, the best day of your life? I mean, just if you can imagine that in your own body and how your body feels, and tell me physical is not a part of that mental emotion, right?
Yeah.
And I don't know, from a chronic pain, if you could speak to that, but psychologically, do you feel like you see a lot of people that are in chronic pain that have bodily pain? I mean, I'm sorry, chronic pain the people that you are seeing, do you feel like some of them have chronic pain issues, whether it's their high anxiety or whatever you're treating them for? Do you see the correlation?
Yeah, dude, that's a good question. I would say that there are people that I see who have chronic health issues, right? They're systemically, chronically behind the eight ball with their health. And what shows up for them is you see them turning off from the neck down, meaning I don't want to feel this pain. I often I remember, like, I used to run marathons, ultra marathons, and all that fun stuff. And I have the most sensitive feet on the planet. Like, I hate walking around barefoot. Yeah. And I thought, why did I choose this one? Because talk about hard on the feet, but a marathon and an ultra is really, really hard on the feet. And I kept having people say, well, just shut the pain out. And I was just like, no, if I shut the pain out, I shut the good stuff out too. Yeah. So I'm going to have to learn how to incorporate this pain into my psyche as I learn how to do this. And truth be told, my feet still hurt, but they hurt less every race that I did, every run that I accomplished. And I think I remember thinking as I was running up Lancaster Bridge, good Lord, that's a long bridge that is all up. Yeah. And I remember thinking, like, I really am tempted to shut my body off, like shut my mind off from my body. But the way that I learned to cope with it was I said, I'm going to think about the people that I know in my life right now that are currently struggling psychologically, the people I was treating, the themes that they were experiencing. And I would hold them in my mind and say, this is what I want for them, is I want them to experience it and I want them to overcome it. And so I'm going to experience it and overcome it, and almost with them in my mind, going to take them on this adventure with me. And that was my way of not shutting off my body, because I wanted my body. I didn't want to lose track of where I was, because truth be told, every injury I've ever had is when I shut off my experience in my body.
Just to push through it.
Yes.
Yeah.
Yeah. And so I do see that with people who have chronic pain.
Yeah.
Or really it's more, it's more of the autoimmune disorder type experiences, right? Because fibromyalgia, everything hurts. Well, of course it does. There's so much going on, and I hate it with capital HATE, hate it. Yeah. When they see a doctor say to somebody, it's all in your head.
Oh gosh. Right.
And it's like, well, everything's all in our head. Yeah. Everything originates in our brain.
Yeah.
So, okay. So you're telling me my excitement's all in my head. Okay. But it's so demeaning. But really, there is a painful experience that is expressing itself out of all of your nerves.
Right.
So rather than shutting off from this, how do we incorporate a healing space?
Right. And the word that I heard you say is experience a few times. And so how we kind of relate that is sense, same thing. An interoceptive sense is huge. If you cannot sense it within your own self, how are we going to experience it? Right. And so that's a big piece of what we do with PRI, and trying to get yourself, and this is going to sound really weird, but expand from inside out. Right. And that's more with airflow. And I really truthfully mean that. But we don't want everything pulling in on our bodies. Everything wants to come in. We want to feel safe and converge. We want bodies to be able to move out and expand. Right. And so on one side more than the other sometimes. We won't go into that today.
But think about that from a psychological perspective. Yeah. We do want to move in, and figuratively speaking, and be closed off and silo. And we don't, I was just talking to somebody earlier this week that was saying, all I want to do is I just want to stay home. I don't want to be around people. When I'm around people, I judge myself. And I'm concerned that they're judging me. And so they want to come inside themselves more and more and more. And what's interesting is you see them hunch their shoulders forward, where they're trying to come into themselves. And you think about that, that's a self-protective movement.
Absolutely.
When you're talking about we want things to expand, you think about that figuratively speaking. It's like, what do we need? Right. The world needs love.
Yeah.
How do we get that? We interact with each other.
Yeah.
Right. And so that's where, to me, our worlds really cross over and pendulate together.
Sure.
I mean, I know you call it oscillate. I call it pendulate.
That's fine. I'll let you use that word on my podcast. Yeah. So that's really why I work with an optometrist. What you just said is open up peripheral space management. We're living in a world that is so narrow focused and forward. Right. And, it's actually one of the number one diseases growing. It's called myopia, nearsightedness. And it just makes you wonder, right? We're going more to this tech world. People are staring at computers. Everything's coming in. We're pulling forward. And that would be a whole nother podcast we could talk about, right? With nervous system. But how do we get these people to open up, expand mentally, physically, and feel safe to do it?
That's what I was about to say, is you have to teach them. We have to learn as a society that it's okay to take a risk, because in those risks, you may fail.
Yeah.
And failure cannot define your value. That our value is defined, I believe, by the fact that you have breath in your lungs.
Yeah.
I mean,
totally.
We are valuable, period.
Right.
Now we move forward.
Right. Right.
So,
yeah. And, one thing that, like, for anybody at home, when it's kind of like, what is she talking about? Expand air, right? When you think about your lung field, you've got lungs in the front, but you also have posterior lungs. And what's really interesting is during the COVID times, with people that were really struggling to breathe, they were proning them in the hospitals, which means putting them on their stomach to get air posteriorly. And that's your posterior lungs. It's right around the bottom of your shoulder blade, your scapula area. That's called your posterior mediastinum. And that's a point like where I'll have people. So even if you're sitting at home, I do this in my car a lot, but just kind of rounding and slouching your lower back and taking your sternum and pushing it down and back and trying to breathe air right into that area to decompress yourself. Because anatomically, it's called your posterior mediastinum. Your sympathetic nerve ganglion live right along that spine area. So imagine if you're pulled forward all the time and you can't decompress and breathe into your back, how's your brain and your nervous system going to feel? Right. And so, once again, that's where we collide our worlds. It's like, okay, let's work on this breathing thing so maybe what you're receiving during your therapy session will be more easily accepted, less threatening, more digestible to your brain.
Right.
Because you're going to be in a place where you can learn. Right.
Yeah.
So
this is such a fascinating discussion, and I've always appreciated your work. Very candidly, you have helped me through a back surgery, a shoulder surgery, and kept me ready for when my agent calls for when it's time for me to go to the NFL Combine.
And the running joke behind that is when you'd come in, I'd be like, oh, is the Combine soon? Like, why are we trying to bench press 225? Very proud of you though. Your accomplishments.
Yeah. Yeah. But it's the whole space of just, helping me stay on the road of running, helping me with all of that. So for that, I'm deeply grateful, but it's also fun to have a kindred spirit to talk through these things with, to see that the physical and the metaphysical really do belong together.
Yeah. And
to have a like-minded person that or people that a community that is being developed and built so that we have help.
Yeah.
Help for wholeness and wellness. So
that's really interesting. Ron said, it was a certain patient that I was asking him about, and he said, Casey, if we don't do what we're doing, where are these people going to go? And it was so true. I was like, oh, yeah.
I love that man's heart. I love the way he thinks, because he thinks in the wholeness. Let's go help those who have historically been unable to find help.
Right. And we just had our symposium, and we had a PT that went back and got her doctorate in psychology. She presented. We had a licensed social work present. So we're very open, love to collaborate with professionals. I mean, obviously you're a part of my team, and optometrists, dentists, because these people have got to be managed sometimes more than just one person, right? And kind of takes the stress off, right? Knowing you have a team that thinks like you. It's like, oh, if I send them over there, I know that they're thinking like I'm thinking. And
yeah,
it's
and
not common.
allowing us as professionals to live more in that open stance as opposed to a closed stance where we think we're supposed to have all the answers.
Yeah, no, totally. Yeah.
Yeah. Well, thanks for coming on today.
Yeah. Thanks for having me.
Yeah.
Appreciate it.